Professor Farida is a professor of medicine with oral in the oral part, or she will explain to us. But she is a well-established medical academics and a clinician. She used to be the president or the director of the British Dental Association. She had many awards, but the more important awards for me, in addition to her medicine, she used to be the dean of the Faculty of Medicine at Queen Mary University. She has been highly regarded, respected, and if you like, awarded many things to do with her role in changing our lives from a community perspective. I think in 2009 or 13, I can't remember the exact date, she was one of the most influential Muslim women in the United Kingdom. That was a big prestigious award, I think, to be influential. The word influential is very important. She also very keen, all her work is about community, how to let community actually help themselves, educate them. But in terms of her medical field, I think she's one of the most distinguished professors in the United Kingdom. I can't really read all the letters after her name, Rabbani Zidiki, her professor. It's quite a long list of names. She's an OBE and so many and so on. But more importantly, she has done lots of work in developing countries to understand the problem well. But what we are asking her here about the current situation in our hospital in the United Kingdom. She's a consultant and she's a frontline. And I think she shared many of the views of other consultants and the NHS, and we really commented all of them. We have seen them in the news every day crying in tears, particularly the nurses, about emotionally they are drained. So we will give you the chance, Professor, to give us what is the current status in our hospitals. We know the figures from the breast, but the very big question for you, Professor, do you think from your long-standing experience in the medical as a clinician, as a professor, and someone in the hospital, how do you think people could still carry on coping? You guys, the one who are protecting us, we are staying at home, protecting ourselves as much as possible. You there facing the patient, you're facing this COVID. To what extent do you think, or how long do you think you can still continue to cope with what we have seen? We're seeing you crying on TVs. So the floor is yours.
If you have a look, yesterday we had almost 4 million people in the UK who had COVID, and 97,000 of them died. So that's a huge number. In London, we've had more than 500,000 cases, and 1 in 30 people are positive. So if you then, as I said, take the hospital where I am, which I think this most mirrors other countries, rather than some of the places in the UK, you would see that in my hospital alone, something's happening. We have 824 patients, of which 208 are now in ITU. So that is over 1,000 beds. We've had another 760 lab confirmed cases. In the last 24 hours, we've had 62 newly diagnosed patients. So that's more than a lot of countries that had, and this is our largest hospital in our trust, and we have got another 4 hospitals. We have not changed our staff. It is still the same staff that we have had last year. So the pressure on staff is absolutely amazing. The pressure on our beds are worse. We had some mothballed wards on the last 2 floors of our 15-story building, and they're now almost full. If you go to ITU and you look down a 40-bay ward, I don't think there's anything that can be the same as that. And as you were saying, Prof. Amal, do you think people will survive going into next year? I think it's really difficult. I was born in South Africa, I've been all over the world. I've seen a huge amount and experienced a huge amount. And I think really my faith has been a huge support and kept me going. But even I have to say, I really don't know how long everyone's going to be keep going. And those ITU sisters and nurses who are there day in, day out, day in, day out, a huge amount of them have sort of post-traumatic stress syndrome, and really, but having said all of that, everyone has given their best. So what has actually brought us to this, and what do we think we can do, and what could you do out there that can stop you getting to this? I mean, it's absolutely awful. So I just go to my next slide. Mervyn? Let me see if I can get it. Yeah. So, okay. So if you look at the people who are affected, you'll see it's our Black and ethnic minority group. Okay, so I can't go down. Mervyn, can you just show me the next slide? Yeah, next one. Yeah, that one. This one here? Yeah.
We can see it.
You can see it, yeah?
Yes, we are seeing it.
Okay, so if you have a look, you can see this is the Black and minority ethnic group, which is people like you and me in the rest of the world and in Africa. They are disproportionately affected, both in the general hospital and the intensive care unit. And there are a huge amount of deaths among them. And we have to say, what is this? What has caused this? And I honestly believe some of this is, obviously there's a genetic basis, there's socioeconomic, but also I think there is behaviors. In the first lockdown, everything was really tightly controlled. We only had 10 people at funerals, we had no social gatherings, and no weddings. And I'm afraid the second lockdown, people found it quite confusing. And the third lockdown, I think we're only beginning to notice what we're doing. If you can just really get people to follow basic rules. Now, in all the countries, you know, the Islamic countries, you're supposed to wash your hands 5 times a day. The washing of your hands is exactly the same as you wash your hands for wudu. People are not isolating or social distancing. And I thought quite a lot about this. And actually, when I talk to patients, they don't really understand. We all come from very social communities. They don't understand what isolating is. One patient said to me, "Of course, doctor, I isolate. She said, I'm in my bedroom all day and I only watch television with my family in the evening. I only go and visit my auntie and it's only the 2 of us." So I don't think actually we've got the message over. And I think that other countries have to think quite carefully. The other thing about isolating is in some communities, if not so much here because we have got social support, but in Africa, if you isolate, you don't eat. Okay, and someone in Zimbabwe said to me, "You're telling me to isolate? Are you telling me to die? Am I going to kill my family because they'll have nothing to eat?" So you have to develop strategies so that people can function within this. And unfortunately, there is a huge amount of false information. I don't think that this can be underestimated. I have family all over the world. And the WhatsApp and messages I get are totally unbelievable. I'm not quite sure why people are so keen to have false information, and even leaders of communities are sending these out, thinking that they're actually doing the right thing. Somebody sent me a Pfizer package saying they're going to put DNA into your body, and this was in June. And Pfizer is stored at -80, so they never had packaging. But people are so clever in doing this and sending to people. And I think what's happened is the fear amongst the community have overtaken everything. So if you're fearful, you will only believe the things that are actually making you more frightened. And I do think Prof. Alam is correct in saying, more of the community leaders need to come forward and show people. But I know, I see the imam from the East London Mosque. He comes every single day into ITU, every single day. So the emotional trauma for him is even greater. But people still don't even believe him because they're sending WhatsApp showing corridors which are empty. Of course they are, because it's our patients, not the wards. So they are not believing, He said, see my eyes, would I be telling you lies? See my mouth, would I be telling you lies? See my ears, would I be telling you things that are lies? But people still don't believe the community leaders. And I think that opening the mosque in Birmingham, the vaccination centre, is hugely influential. And people like the imam going onto TV showing that they have been vaccinated is also hugely important. I was at one of the vaccination centres last weekend, and when the foreign names were called out to go forward for their vaccination, so these are all people who have been prioritised by the government, they have not been disadvantaged, they've been prioritised, only 2 out of one group of 15 turned up or stood up. And then as they were calling over the next, I think 3 hours that I was there, in every group, there weren't any with foreign names. So we're not going forward for it. We're not changing our behaviors. And I think you can't blame people. They are so fearful. So I do think as a community and the community leaders, we have to develop strategies to take this forward. Because I think there's still non-understanding. I think people don't know what isolating or shielding is. And I think those concepts have to be made much, much easier. And I think if you talk to people in a language that they understand and in the social mores that they understand, they will listen. So even in the hospital, some of our ethnic staff were refusing to have the vaccine. I spent half an hour with somebody quite senior who then said, I now understand and I'll go forward. I was in a room with about 20 people. Only one of them was not an ethnic minority. A quarter way through, about half of them left. I spoke to the others. They went forward and had their vaccination. We must make sure that everyone has, because if we don't have the vaccination, we won't have enough herd immunity and we'll have another surge and another surge. And I think that, you know, if you look at the cemeteries, they are full of people like you and me who never thought we're going to get this. Also, that when people are ill, they need to contact, we've got a fantastic system, NHS 111. If they are ill, they're not doing it. So the time people come into hospital, they are already very, very unwell. And that's why most of our patients, the ethnic minorities, are ending up in ITU. It's not that they're at disadvantage. It's not that they have not been given access. Everyone is working very, very hard. If you're in an ITU and you see everyone is an ethnic minority, all the nurses, all the patients, you know, there is nothing about it. You cannot say I'm disadvantaged. If you need to be there, you are there. And if you are there, you are treated with the most amazing compassion. I saw someone after 12 hours who could barely stand up, wash a patient and talk to them in the most compassionate of ways. And we have to do that. You don't know if they're going to be there the next day, and do your best for them. And they're all doing this, but we're still on this trajectory. The good news on the horizon is Dr. Osman was brilliant explaining the vaccination. And please, everyone, if you have the opportunity, if you get that email from the NHS, go and have your vaccine, right? You have all, if you've come from Africa, where I was born, you would have seen polio and people not being able to walk and in chairs or not being able to breathe. The child next to me, when I was a young child, died, right? And they died of having tetanus. We also had terrible measles outbreaks where children died. Do you remember whooping cough that we had? We don't have it anymore. And why? Because they vaccinated, and it's all the vaccine. You remember? And so now you take your children to be vaccinated. You're going to have your flu vaccine every year. It's exactly the same. And this is the one thing that will help us. And then the other thing is, could I say and reach out to you and say, have faith, keep your iman. Don't become so fearful that you cannot cope with anything else when you become ill. And I've seen people, you know, not far from death, so fearful, and just actually reminding them who they are and letting their minds reorientate. It's amazing how people can cope a lot better. And we all have to do it, not only, as Dr. Osman said, for yourself, but you have responsibility for your family, and you also have a responsibility for not infecting the next one. Remember, up to 1 in 3 people can be symptomless carriers. So you can say, there's nothing wrong with me, I don't need to have it. But actually, you might be carrying it, and you might be responsible for the death of another person. The other advantage about having the vaccine is a very selfish one, because if you get COVID, you can get better, but you can get long COVID. And long COVID is having the symptoms of COVID when the virus has disappeared, which continues and goes on and goes on. You can have problems breathing, problems walking. The worst one I've seen is when patients have such fatigue, tiredness, that they can't manage to do anything at all. People have a continuous cough. People can have sweats that go on for months. So you don't want to have that, all right? You might say, I'm young, get over the COVID, nothing will happen. But actually, young people can get long COVID as well. So I think with all of those, and as I say, mine is just talking to you from a community point of view, because I think all the other issues have been dealt with. And we vaccinated about, I think today it'll be about over 6 million people. We also have a responsibility from countries like the UK to work with all the African countries to make sure that they get vaccine as well. I know South Africa is going to get AstraZeneca, Zimbabwe, and I think Malawi as well. But actually, I think as the diaspora, we have to work together and advocate for everyone, everywhere, to be vaccinated. Thank you.
Thank you very much, Professor Farida. And I think the last concluding point you mentioned is going to be explored shortly after you. We had a couple of initiatives, we want to discuss them. Can I just ask you a quick question? Thank you very much for these 2 questions, actually. One of them, I remember you are one of the people who advocate or been campaigning from last March, I think, about community, they have to do this and they have to follow. Are you, to what extent you are feeling, are you happy with the progress you and others have made to educate the communities? And now you, as you mentioned, we have a mosque in Birmingham opening the gate in BBC. The Imam was injected in front of people and he delivered a message live and he said, there's no other way to get out of this from here. And the second one was in East London, you mentioned it. Are you happy with this progress or do you want the community to do more? And secondly, I know the first session was in Arabic, but I tried to translate to you. 2 of them, they said in Darfur, which is quite in the west of Sudan, he said, the consultant there, I think he's still with us, he said one of the major challenges for them is the stigma. People, they don't want to talk at all about COVID. And he said something, you said it as well, even in the UK, that even medical staff, they have this stigma, unfortunately. In Darfur, they have it. The same was echoed by those in another central state of Sudan. So from lessons learned or from your experience, so 2 questions. The first one, how happy you are with the progress we made in the UK in terms of educating the community to take the vaccine? And secondly, what advice or lessons learned you can give to those in Africa, like in Darfur? What can they do? That's a major problem, the stigma problem.
Yeah. So I think we've done a bit in the UK, but we've actually got a lot of work to do. As I said, when there's still medical people or people working in a hospital who say, I'm not having it, then actually you haven't done well enough. So I think that engagement, I think the East London Mosque has done a lot of work, and I really cannot praise the imams enough. I think the rabbi in East London has done a huge amount of work, and they still went, there was a big wedding, all right, recently, even though they do a huge amount of work, and the priests. I think the faith communities have been very good. However, we've forgotten that's usually the older generation, and we've forgotten this younger, computer-driven, WhatsApp-driven phone generation, which is driven by the phone and have been absolutely terrified by, to an irrational extent, by telephone messaging. And I'm not quite sure if it's because they're on the telephone constantly getting these constant messages that in the end they can't differentiate and they just become more and more fearful. A lot of them are at home, a lot of them are in lockdown, so this is increased. And I learned that from the only 22 anti-vaxxers originally sending all this information around, and managed to scare everyone. So that we haven't addressed. And I'm not quite sure. I think there's lots and lots of work to do with younger people around this. And it's because they are, this generation, so the middle generation, they make the appointment for their parents, the older ones in their family, because you live in large family units, and saying to their family, you know, one of our, someone I know had said, I told the doctor my mother's not having the vaccination. And I spent some time talking to her. She said, I now understand. I was so scared. And that's the thing. That's the scare and the fear. We've got to do something about it, right? Everyone else is doing their job. We cannot blame the elders in the community. Then the other problem is we do have this huge thing in our communities with stigma. I think now in London, where it is so rife and we have so many deaths, that it's become something which you can't hide. And so people have begun talking about it, but people are still not coming forward to saying, I'm unwell, until they're very, very unwell, until they can't breathe at all. Whereas if they went to hospital or contact their doctor a bit earlier, that would make a difference. And I know, I mean, I think that in a lot of parts of Africa, we just need to do this much more engagement and show people. If you remember with Ebola, right at the beginning, that was a problem as well, till it was so overwhelming that everyone had to face up to someone, 1 or 2 or 3 or 4 in their family dying. And I know in South Africa at the moment, that is the case. And it's got to a point where everyone is now seeing everyone dying around them, that all the cemeteries are full. So it can no longer be a problem. And I know in the Yemen, where they had so many cases and people couldn't access hospitals, they didn't want to go back into their homes, so they just lay on the street to die. And I think that when it comes to that number of people, there's an acceptance, but we have to develop strategies of making our people know and think that this pestilence, although it may be a trial, it hasn't been sent there for them alone, and that they've been punished by it. Because that's it, you know, I'm being punished. I can't show anyone else this punishment or this happening to me. It's probably something I've done and it's so terrible, and then they go and hide.
A question we're going to ask you now from the Facebook, but those in the Zoom, could you please raise your hand? We can give you 1 or 2 chances. There's a question, Farida, just to finish with. People are very sympathized, and you know they appreciate the work doctors and all the NHS nurses and so on really do for this country. Everyone appreciates that, no question. But still, you can see nurses and consultants in hospital, as I said earlier, they are crying, saying they want us to do more. More than what we have been doing. Most of people, I'm sure you agree, most of people, they are law abiding, they staying home, they follow the regulation, but there are those who they break it. Is there any much more people can in-house, not to say to show how grateful we are and we thank you, but apart from us staying home, stay protected, is there anything we should do to help these nurses in hospital crying in tears? We have seen this every day. Is there anything we can do? Shall we maybe propose sending messages to hospital, each local hospital, video recording messages from home to people? Is there anything you have in mind which could push up the morale of staff?
I think, you know, I have to say to you, I've never, ever, ever seen anything like this. I don't think, I mean, I think you can say you're wonderful, you're nice, whatever. Actually, I think when people see what people in hospital are seeing through the hospital eyes, will they only then have a wake-up call? Because whatever you say to them, if their narrative is something else, they're not hearing you. They're not seeing you. They're not listening in any way. And so I mean, I think people are really, really nice. People are always sending things into hospital. Things are sending food, sending photos, sending nice things. What we want is less patients coming through. What we want is less patients dying. What we want is less patients testing positive. If you don't do that, okay, then nothing is going to happen, right? As I say, the thanks, everything is there. I mean, people are on the, I mean, I think people are at the end, all right? And I don't know how you're going to have a workforce that can go on like this. 1,000 beds. I mean, 208 patients in ITU today in one hospital. Okay, and there's still another over 800 patients needing care, you know, with one hospital staff. And I can tell you, everyone is working. All right. What about the other hospitals? So the whole country is like this. Please, in the name of God, have a look around you, see what's happening. But people still don't believe. You'll still go to, when I come home, there's big notices saying COVID levels are very high, please go home. Please stay at home. And then you see people on the street. And I don't know. And now you're seeing much younger people coming through and also ending up in ITU, because this is a belief. It's not going to affect us. Well, I think what we want is, please let us see those admission figures drop. Let us see the death rate drop. Let us see the beds not being added to, but taken down. Let us see some empty beds. I don't know when last I saw an empty bed. We just don't see it. As one person goes out, another one comes in. So that's what I'm saying. That's where I come from.
And I think just to echo what you said, even the Prime Minister, after he got it last year, he himself, in one of the press releases, he said, he didn't say, I didn't realize how the remarkable work NHS is doing, but he said, now I have seen it by my own eyes. The cleaners, the ambulance driver, everyone. He appreciated, in a way, he's shocked. What you are doing, he said, is beyond anyone's expectations or mine. People, they just see. Now I think the question, هل صحيح توجد علاقة بين المناطق اللي فيها ملاريا? Yeah, Ahmed, do you have any question quickly? Olivia also, if you want to comment. Joseph is doing lots of work in community, I think in Kent. Also, if you want to comment on Farida, please raise your hand. Ahmed, you said there's a question from South Sudan or where? Ahmed?
Yes, that's correct, Prof. There's just one question from regarding the South Sudan. So the question is, countries like South Sudan and other African countries, they don't have much infection. Do you think that they have super antibodies in their blood to resist COVID-19? If so, why scientists study such cases? Why scientists study such? I think the question should say, why not scientists? Why they do not study such cases to generate vaccines?
Are you aware of not just South Sudan, but other African countries where there is any cases or there is something to be studied, Farida?
Yes, I mean, I think it's very interesting because a lot of African countries that was in the last wave had much less patients than everywhere else. And one of the things that was raised was that, in fact, the population in Africa is very, very young. Okay, if you take, it's always difficult to say Africa because, you know, there's 23 countries, because if you take these countries, more than half of them have about 80% of their population under the age of 25. So that could be a factor. But the other factor is that if you look at the previous amounts and you look as the wave is again going up, we're now having more cases. So it could be a demographic thing. It could be something to do with patients' age. I do believe that Dr. Ahmed makes an important point that we also need to look at the genetic pathogenesis to see who are people most susceptible. And there's some data coming out now to show it's not only the comorbidities, but there's some other pathogenesis, probably genetic, which is also playing a part. But I do think that, you know, the wave is probably going to go up, and as we get into another change of season, we should be quite careful. And I think in countries where they don't have high caseload, should try and actually keep it that way. And in fact, I know in part of Sudan, they've got not a lot of resources, but their track and isolate is very good. And most of Africa has always been very good because they've had a much more of a district nurse, local nurse-led health system where this took place. And you can see the nurses who led TB would do that. Track, isolate, track, isolate. And I know in part of Sudan that had worked very, very well and kept their caseload down. And we didn't do such a good job in Europe at all.
Now, Farida, if you stay with us, thank you very much. This is very useful. Thank you so much.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد. بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ممتد لحد حدود